Good morning, everyone. I'm Cindy DeWeese, the President and CEO of the Clear Lake Area Chamber of Commerce, and we're so happy to have you join us for today's seminar. We are looking forward to discussing our plans to get employees back to work. How timely is that? But first, I want to start with a little housekeeping before I introduce our speaker, and please turn off your cameras to ensure the clearest quality possible or connection possible. Everyone will be muted. So if you have any questions during the presentation, please use the chat feature so we can address them at the end of the session. So now I am happy to introduce our speaker and welcome to Karla Saenz. Karla is the Director of Human Resources at Employee Solutions Incorporated and directs the overall provisions of human resources and provide employee orientation, high-touch culture, and emphasizes quality, productivity, and ongoing culture of an excellent in-client service. Karla is the HR professional with extensive experience in managing full spectrum of HR programs, services, and functions across multiple industries. One of Karla's goals is to build and sustain partnerships and communities among HR professionals. She is a member of HR Houston and holds a PHR and SHRM/CP certifications. Welcome, Karla. Thank you for joining us today.
Hi, thank you. I'm so glad to be here. Thank you for the introduction, Cindy. As you mentioned, I will be going over bouncing back. So, you know, as we transition to what someone just mentioned earlier, the new normal, we are considering a lot of what we need to do to prepare for that. So I will be joined today by Brian Rothermel. He is your local Clear Lake Area Chamber of Commerce member. He's going to help me with some of the Q&A at the end, so we'll hear from him a little bit later. And as we dive in, I just want to know that we will be taking questions at the end. So we do have a lot of information to cover. We're going to move fast. We may not be able to cover everything. And we want to keep you aware that situations and laws are changing frequently. And this webinar is not suitable for legal advice. So if you have any questions that are legal in nature, please consult with an employment attorney. So a part of any good strategic reopening plan should include planning for the unknown. You know, maybe you're able to go back to work now, or you've already been back to work, or maybe you're planning to do so in the near future. And I just want to share a quick story. We work with a client that has a hair salon. So he was super excited when Governor Abbott said they could reopen. And he says, I've been in constant contact with my employees. They said as soon as we got the green light, they're ready to come back to work. So he was like, no problem. What do I need to do to get this going? Then he calls me back and says, 4 of the people actually aren't comfortable coming back to work. What do I do? So you want to plan for the unknown. You know, make a plan if someone has safety concerns maybe you weren't aware of, or any other issues that you plan for that. You want to ensure that you have some consistent communication and transparency with your employees. A lot of what we're worried about is, you know, we're all watching the news, checking social media sites, and a lot of what we're reading and hearing about is COVID. It's a lot of what we're talking to our family members about. And as we're thinking about reopening, what's top of mind for a lot of people is it safe to come back to work? What is my employer doing? And then, of course, you know, reintroducing employees to the new work environment can look different for every business. So be patient and know that every business is unique. So the first step would be to evaluate when to reopen. You want to involve your management team in those decisions when possible. If you can get all your managers on those calls and that planning, they might have information that they're privy to that you didn't know about. They may have been staying in touch with their employees and they know what concerns they have, so that helps with planning for the unknown. It also helps for them to know what you're deciding to do, because this is who your employees will go to if they have questions. So if management's involved in the beginning, they know what went into the decision making. And of course, you want to continue to monitor any federal, state, and local closure orders, reopening guidelines. And of course, there's a handbook to reopen Texas that's available. The Chamber actually has a lot of great stuff on their website, so if you haven't checked that out already, I encourage you to look at the Clear Lake Area Chamber's website. They have lots of good tools and past webcasts on COVID topics that could be beneficial to you. All right, so now that you know when you're going to reopen, What about who should you bring back? You know, that's again the discussion you need to have. There's no question that everyone will need to adjust, and when you evaluate those staffing needs, you want to be sure that those needs are consistent with legitimate business needs. You know, we hear a lot about low-risk employees, and we were told in the beginning, you know, people younger in age were low risk, and maybe even children weren't getting it. And now we're hearing that's a little different. We're starting to hear that children are getting some symptoms related to COVID. What about those at higher risk? We hear a lot about persons age 65 or older, or people with underlying health conditions. I think it's okay to consider that as part of being prepared about what questions you might be asked about safety and maybe even accommodation questions, but it's not okay to exclude these employees on that basis. Because if you do, let's say if you say, you know what, I'm not going to bring back anybody age 65 or older because I know they're going to be concerned, they're not going to want to come back anyway. You know, decision-making like that could violate anti-discrimination laws. So you want to be careful that that is not the basis for your decision-making. You also want to be careful about retaliation claims. You know, if you've had this chronic complainer and you're like, oh, this person's always complaining, I know they're going to complain about the work environment, they're going to say we're not up to safety standards, whatever it is, we're not going to call that person back. That could be a retaliation claim. So you want to be careful that that's not, again, not the basis for a decision not to bring someone back. All right, the next thing you might want to be thinking about are some pay issues that you might have to do. That your budgets may look a little different, right? So some things to consider with non-exempt employees is they can experience a pay reduction in a couple ways. It can be by reducing the number of hours they work. So if they work less hours, they're taking home less pay, or reducing the hourly rate. So if you're going to do any kind of rate reductions, we recommend that you do that going forward. That's not something that you do reactive. And if at all possible, you know, don't do it in the middle of a work week or in the middle of a pay period. So those two don't always align, you know, but if a perfect rule, if it does, then that's our recommendation. But of course, always give notice, and that notice should be in writing. So what about if you have non-exempt employees that are working from home now? You want to be careful about off-the-clock work. So, you know, I've heard a lot of business owners worry that they couldn't telework right away, and then once they did, they worried, well, how do I know my employee's working? And I think the bigger concern here is, what if this employee is actually working and not through their lunch? What if they don't have that 1 hour, that 30-minute break period to be free from their duties and not perform work, right? So that's a bigger problem, because if the employee is working off the clock and they're not being paid, that could be a wage and hour violation. So make sure that you have a policy addressing off the clock work. And it's pretty simple, just letting employees know that as soon as they perform any work, they should be clocked in. So again, with budgeting, one of the things you might think about if you don't have it already would be a policy on overtime. If you don't have one already, you can simply say, you know, any employee that is going to work overtime, which is over 40 in a work week, should have advance notice and approval from their manager before working that overtime. So this could help you. However, if you have an employee that does work overtime, even with that policy in place, you still do have to pay that employee for those overtime hours. And I know that could be pretty disappointing to hear. So you do still have to pay it. So it was hours worked, so you want to pay those hours. But what you could do is enforce your policy. So you can say, hey, you were made aware of this overtime policy. You didn't get advance approval from your manager before working those hours, and we're issuing discipline. And of course, if that behavior continues, the severity of the discipline could increase and could ultimately result in termination. All right, what about schedule changes? You know, if something you're considering is staggering hours and there's going to be a schedule change, you want to notify your employees of that in advance, because a lot of us might have some child care issues that maybe, yes, we're ready and willing to come back to work, but I was prepared to do that at the regular schedule I was accustomed to. I wasn't prepared to have that kind of child care, elderly care for this new schedule change. So again, just making sure your employees know what you're thinking, you communicate, and that they know so they have time to prepare for something like that. Exempt employees, you know, it's a little different. If you're considering reducing schedule or reducing salary, or maybe both, you have to know that with exempt employees, there's a minimum salary threshold that they have to meet. So they have to be paid at least that minimum salary, and you cannot reduce their salary because they work less hours. So the general rule here is if you're exempt, you're getting paid the same predetermined salary whether you work many or few hours in any work week. So be careful of making any reductions week by week or every other week, because that could jeopardize their exemption status. And with an exempt employee, you know, if the job changes, you want to make sure that you update that job description and that still captures the essential duties of that job. And you want to take a look and make sure that those essential duties, if they were removed, does that then jeopardize their exempt status? So lots to think through with that. And if you're fortunate enough to have your staff able to telework and maybe you've implemented it and you're not sure if you should keep it intact or not, you should consider that the models that we've been shown are representative of a first wave, right? What we're going through now with coronavirus. But what if there's a second wave, or what if there's a third wave? Because this is possible, you may want to keep the remote work capabilities intact. You know, doing so, you know, should you have to shut down again, will allow you to resume business operations with little disruption to work operations at all. And then some jobs we found are effectively handled at home. I know that here we're fortunate enough to have been able to telework, and what we did was a survey to our employees, and we said, hey, how is the culture in the workplace like? Are you getting the communication you need from management? Are you collaborating well with your team? What about other teams? You know, we kind of solicited their feedback to see how they like the telework arrangement, and we've decided to keep it intact for a little bit longer. It also allows for physical distancing. You know, as you worry about workspaces and you prepare for that, if you can allow telework a little bit longer, you have a little more time to figure out how to allow for that physical distancing. And of course, retain what works. You know, employers like it. It helps save some overhead. Employees like it. It helps save some of that commute time. So if it's working for you and you're able to do it, you might want to think about retaining that. You know, whether it's a couple days a week and you add some flexibility, or if you do it on a more permanent basis. And you're generally not obligated to permit telework unless it's something that you do as part of a reasonable accommodation. And we're going to talk a little bit about that. So if you're an employer that's covered under the Americans with Disabilities Act, the ADA, you might have to make a reasonable accommodation for disabilities. So to be covered under this act, you have to have 15 or more employees. And right now, some of the accommodations could be as simple, and I think a lot of you have seen this, is plexiglass or other separators at work. You know, we've seen them in grocery stores, and restaurants are doing this just to allow for that physical distancing and curb the spread of the coronavirus. So you might hear employees ask for that. However, you're not required to make accommodations if they cause an undue hardship. Okay, so if it's a huge financial burden for the business, you're not required to do it. That might actually be more common right now with a lot of business reporting loss of revenue or having fewer workers. It can make it more difficult to reassign duties, so that might be easier. But if you do have a request, you do have to engage in this interactive process with your employee. And what that is, it's basically a conversation. You want to ask them, okay, what accommodations do you need? And it might be something like, well, I need to be able to have some accommodation other than a mask because I have difficulty breathing already. Or telework might be that accommodation. I mean, it could require some information from their physician, but again, it's a discussion. So don't just say no when someone asks for some accommodations. You really want to look into it, and if you have any questions or need help with that, we encourage you to talk to your legal counsel to help you through that. All right, so now you know when you're going to reopen. You have an idea of what you're going to do. You're ready to make offers. We recommend that you make those offers to return to work in writing, right? So you want to include a clear date by which the employee must respond. The language should say that failure to respond by that given date will be treated as refusal to return to work. Okay, so we're just saying failure to respond. We're not saying failure to come back to work means you're refusing and you'll be terminated. We're just saying we haven't heard from you. So this is their opportunity to tell you, hey, I'd love to come back. However, here are my concerns. And in that case, that might trigger that interactive process. You need to be sure that include this statement that refusal to work may disqualify them for unemployment benefits. And again, you want to document this. If any of you have any loans under the CARE Act, they also recommend that you have this documentation for that purpose. All right, so we said it may disqualify them for unemployment benefits, right? So the TWC released some guidance on April 30th on this subject. What they've said is that claimants can continue to receive unemployment benefits during the pandemic if they decline offered work for one of the following reasons. So if they are an individual that's at high risk, so that's someone 65 or older, they're able to decline because they're at higher risk of getting COVID-19. Or they're an individual that has a household member that's high risk. So if they have a household member, you don't want them in the workplace because they can infect others, right? So that's someone that could continue to collect benefits. If they've been diagnosed with COVID-19 and haven't fully recovered. If they have a family member that's been diagnosed with COVID-19. And for the purposes of the TWC announcement, family members, anyone in the home. And if they're quarantined due to close contact or exposure, and that quarantine period hasn't expired, they can also continue to get unemployment benefits. And no child care. So if they don't have child care and they're unable to find alternatives for child care, they can continue to receive unemployment benefits. But again, you don't know this unless you ask the questions, you ask the why. Why are you declining reinstatement at this time? And they've also said that any other COVID-19 related issue would be dealt with on a case-by-case basis. All right, so again, ask the why. Why are you declining to return to work? And we want to remember that when we talk about return to work, we're not just talking about a physical transfer from one place to another. The workplace that they left looks much different than the one they're coming back to. So be mindful of that. You would acknowledge that and build some room into your plan again for the unknown. And then when you ask that why, if they have a COVID-related reason, they might be entitled for emergency paid sick leave. So if you're an employer that's covered under the Families First Coronavirus Response Act, which is pretty broad, it's for any employer under 500 employees, unless there are some exemptions. If you're healthcare, you might want to consult with your attorney about exemptions to that act. But if you are a covered employer, you might have to provide the Emergency Paid Sick Leave or Emergency Family and Medical Leave Expansion Act. So if you meet reasons for qualification for Emergency Paid Sick, there are 6 reasons that an employee could qualify for that. And for the Emergency Family and Medical Leave Expansion Act, it comes down to child care. Now, if they say, well, it's none of those reasons, they're declining for some other reason, you do not have to pay them. And you also do not have to let them take any paid time off. Okay. You also want to take a look at something maybe a lot of employers haven't had to deal with before, which is the National Labor Relations Act. Usually you know about them if you are a unionized workplace, and if you're not, you've probably never heard of them. What they've established is called protective concerted activity. So this is when 2 or more people at work come together and they talk about terms and conditions of employment. So what the NLRA has said is this is called protected activity, because how can employees ever unionize if they're not able to talk about terms and conditions of employment? So they're giving them the right to do that. So some examples of this could be expressing safety concerns. If an employee has told you, hey, I'm declining because I don't think you have appropriate PPE, I think you should give us hand sanitizer, I think we need to be provided masks, that kind of thing. If you take adverse action on that in person because of that complaint, that could be something they can go to the NLRA and complain about. Walkouts and protests. So you've seen some of this with Amazon. That's protected concerted activity, nothing that you could take adverse action over. Social media posts. So if you have, let's say, a company Facebook or a company LinkedIn, and you have an employee, you posted something about maybe what you're doing, and an employee posts in the comments, I hate working here, they don't take our safety seriously, and then another employee says, you're right, we should do something about that. You really shouldn't take adverse action on those employees for expressing that. They're, again, expressing protected concerted activity here. That's something you just want to have a conversation about, address those concerns. And then OSHA. OSHA says employees may refuse to work if they fear they're in imminent danger. A pretty obvious example of a refusal here would be, let's say, an ER nurse that doesn't have proper PPE and she's tasked with treating COVID patients. I think any reasonable person would say, yeah, she has the right to fear that she's in imminent danger, right? She may contact this virus. All right, but what if you offer and they accept? I think that's great. So this is where we hope to find ourselves, right? So if you have policies and you do background checks, what is your policy about background checks when you bring employees back? So whether they've been laid off or furloughed, you know, are you going to background check them again? Are you going to drug test them again? The rule of thumb here is you don't have to, maybe until after about 6 months that they've been gone, unless you have some kind of agreement with a customer or vendor that requires you do so. What about other new hire forms? Are there any forms or policies that you've implemented since they've been gone that you need to make sure that they're aware of? And then what they're going to want to know about is their waiting period. Do I have to satisfy a waiting period to be eligible for company paid benefits again, or to be eligible for 401k again, or do I have to start over from my PTO, or am I going to be honored my seniority from when I was first here? So be prepared to answer those questions. The more the employee knows up front, the better prepared they are coming back to work. So the government has also given us some flexibility in the Form I-9. So as you think about bringing them back and what paperwork to collect, they also understand that a lot of employees and employers aren't in the same workplace anymore. A lot of us are working remotely and we're taking precautions due to COVID. So before, you've always been required to review the Section 2 documents in person. So you're actually attesting that you actually saw a physical document of either the passport or driver's license, Social Security card. But now they know that's not always possible. So what they're saying is we're now allowed to write COVID-19 as the reason the physical inspection was delayed. So you want to write that down in the additional information field in Section 2. And then once normal operations resume, you can notate that documents were physically examined and then date the date that you saw those documents. And that additional information field are in Section 3. Okay, so that's a big win for everybody to know now that, hey, I don't have to risk having my employees come meet me somewhere, seeing each other in person, or those fears about that if they're teleworking. You can hire someone on or bring someone back and take a fax copy, an email copy, a picture, text to you, or a video of those documents are acceptable as examination. All right, another exception they're making is expired documents. So it used to be that we could not accept a document if it's expired. However, they realized that a lot of these offices are closed. So maybe someone who has a document isn't able to get it renewed. So they're making exceptions here too. So you're able, in these cases, to record the document information Section 2, List B as applicable, and enter the word COVID in the additional information field. All right. So as they come back, you want to be sure that you're listening and you're communicating with your employees, that you document any concerns that they raise, and that you document the resolution to those. A lot of us have open door policies. You also want to be sure that you're promoting that open door policy, you're practicing it, and that you communicate on a regular basis. You know, this is a good time to highlight victories that you're having company-wide. You know, if it's that you're able to get people to telework with no time at all, I mean, that's a victory, so celebrate those. Provide updates. You know, a lot of people are wondering when are we going to reopen, or if you're reopened at some capacity, when are you going to amp that up to maybe from 25% to 50%, and then what you're doing to keep them safe. And it's a good opportunity to enhance your social media presence. You know, highlight the positive projects your company is doing right now. Offer gratitude and support to your employees and to your customers. All right. So when it comes to physical distancing, we talked a little bit about this. If it's possible, something you can consider are staggering hours. We talked about some telework, again, if that's possible. And plan to make changes in high traffic areas. So unfortunately, we're all used to being able to stand in line or wait together at a coffee machine or the water cooler or maybe a break room and eat lunch together. That might not be possible anymore, right? So as part of your physical distancing efforts, you might have to make changes there. So you make sure that you communicate that, whether it's saying, hey, we're not meeting in that conference room anymore, it's going to be virtual, or we're not we're not able to have lunch in the kitchen anymore. You have to take it off site. Just make sure that you're making those changes, you're communicating them. The virtual meetings, I think they're happening pretty regularly, so that's something you're probably already doing. And then you want to be sure that you're respecting personal preferences and boundaries. Something else you want to consider is that the landlord might have different rules. So like if you're bringing an employee back to your building, but your building is closed to visitors or vendors and maybe there's a key card required now to come in, you want to make sure they know that. If there's going to be a line to get on the elevators, you want to make sure that employees are communicated about that too before they return to work. I saw in some elevators they're limiting the number of people, and they're like the corners are kind of taped off, and employees have to stand in those little boxes in the corners and kind of look away from each other. Maybe. And then if that's happening, you know, let employees know that. Let them know that they may experience some wait time just to enter the building and get up to their office. And then be patient. You know, habits are really hard to break, so you might find employees congregating in the break room or, you know, talking together while they're getting coffee in the morning. So be patient. Just continue to communicate with your team on what you're doing. Some other things you might want to consider are applying some practical guidance from the CDC and OSHA. You know, there are, in some cases, more frequent cleaning measures may make sense. What about deep cleanings? You know, is that something you might want to do, especially the commonly touched areas? And make sure you have access to adequate supplies, such as hand sanitizer, cleaning wipes, that there's frequent hand washing and respiratory etiquette. The CDC has posters for you, so if you're interested in pulling some of those posters and putting them in your workplace, you can. You want to avoid shared office equipment and workspaces when possible, and consider procedures for sanitizing after use. So this is similar to gym rules. So some of you already used to know that you have to sanitize after use. Same thing here. And then do you or don't you provide PPE, and what types of PPE should you provide? I think we've also heard a lot about temperature checks. The CDC says a temperature, a fever is anything over 100 degrees, so you want to be sure that if you are going to do it, you know, should you? You know, is who's authorized and trained to do this? Is this something you're going to outsource, or is this something that you're going to authorize an employee of yours to do? And if you do authorize that person, you want to be sure that they're trained to do it, that they have the appropriate PPE, and whenever possible, that it's a thermometer that where they don't have to touch, right? But again, if you do it, are there going to be lines of employees waiting to have their temperature taken as they walk into the workplace? And how are you going to deal with that? And what if they're non-exempt employees? Is that considered time that you should pay? So those are all things that you need to think about when you decide whether or not you're going to take someone's temperature. And if you do, you decide you do it, make sure you're also doing it for customers and vendors that come into the workplace to ensure safety for your employees. All right, so if you're taking temperatures, you want to think about confidentiality related to that. So the temperature is considered a medical record. So are you actually going to write down what each individual's temperature was, or are you just going to say yes or no, they had a temperature? Something you think about, because once you have a medical record, those have to be stored separately from the personnel file, and those retention requirements are upwards of 30 years. Confidentiality also applies to an employee that comes to you and says, hey, I think I might have the coronavirus, or hey, I tested positive for the coronavirus. So employees telling you that stuff is confidential. You cannot share that with others. What you would say is, you know, we had someone who's tested positive, and we'll talk more about that in just a second. So whatever it is that you decide, you want to be sure that the testing is job-related, it's consistent with business necessity, it's non-discriminatory, right, so you're doing it to everyone, and it's not broader than necessary. All right, so what if an employee tests positive for COVID? So the CDC has guidance on this. The employee is to isolate or quarantine anyone that has a confirmed case for at least 14 days or until their physician is able to release them. Or what if the employee has close contact with the person? So if your employee tells you they've tested positive, you want to know who they've had close contact with in the last 2 days. And then you might want to make sure that you tell those people, hey, you've had close contact with someone who's tested positive for COVID-19. You may want to self-quarantine for a period of up to 14 days. This is when you want to clean and disinfect your workplace. Maybe you do that professionally. You do some deep cleaning. And the notification to your employees should not include who was tested positive. Okay, so you can't say that Sally was tested positive, but you can just say that you've had a positive test in the workplace. Now, what if it becomes very apparent that it was Sally, right? Because she hasn't shown up to work in a few days, or no one's heard from her. And someone says, hey, I bet it was Sally, wasn't it? I think at that point you just can neither confirm or deny that it was. You just say, I cannot share that with you because, again, there's confidentiality that you're tied to. So as employees come back, you want to think about some of the things we talked about, the off-the-clock work. You know, do you have a policy for that? And if you don't, you might want to consider that. Expense reimbursements, you know, are employees that are working remotely, are they going to have any stipend for internet or cell phone use or anything like that? And if they do, you want to write a policy about that as well. What about your attendance and call-in procedures? You know, should you have more flexibility in those? What about a doctor's note? You know, if your policy says that an employee has to give you a doctor's note if they miss a day of work or 3 days of work, I think that you should have more flexibility in that. You're just not able to get a doctor's note as readily as you have been in the past. And if you are an employer that is subject to the Families First Coronavirus Response Act, you do have poster requirements as well. So those posters should be in your workplace, and because a lot of us aren't always in the workplace anymore, you can post those virtually as well. If you have a company website, or you can email those out. What about telecommuting? So if you're telecommuting, do you have a policy for that? You know, what about privacy and those rules? What about the equipment that you've issued to your employees? Do you have someone that's tracking that equipment and the value of that equipment? And what are the rules if that equipment's lost or damaged or not returned? What about travel policies? Do you prohibit travel right now? What about travel to hotspots? So if someone does have air travel, are you going to ask them to self-quarantine for a period of time? And of course, your rehire process. So are you asking rehires to do background checks, drug tests, those types of things? What are the rules on that? And then, of course, any other new legislation that you might be obligated to post in your handbook. What's also important here is that you train or retrain your managers on these policies, because they're probably your first line of defense when employees are going to ask their manager, hey, what are you guys going to do about expense reimbursements, or can I telecommute? So you want to make sure that they know what your policies are, because more than likely they're going to be the ones that are enforcing them. All right, do we foresee more changes? What about commission plans? It might be a long time before our sales and marketing teams are back to full strength. Were there goals and commissions or quotas that they were to achieve that might be harder to achieve right now? So do those plans need to be reevaluated and recommunicated to your employees? What about performance reviews? You know, what if employees were assigned goals that are no longer attainable? What about incentives or recognitions, you know, for employees that have been there the whole time? You know, is there possible that there's something that you can do for people who kept the business going? What about working parents? You know, is there something that the company can do for that? What about people who have elderly care that they need? And what about flex schedules? I mean, I think there's a lot that we can talk about and consider, and maybe some more changes that we have to make as we reintroduce people to the new workplace. And as we think about the planning and we're ready to reopen, I think we have to remember that we have to develop a plan that is thoughtful, practical, sustainable, and maybe even reversible. You know, COVID is an ongoing threat. Planning is key, and we can't do this alone. Some of the resources I have for you are from OSHA, the CDC, Texas. The Job Accommodation Network is a good resource for anyone who's asking for accommodation requests. And of course, the guidance on the I-9 is here for you as well. We love to take your questions. Brian and I are ready if anyone has any questions they'd like to share with us.
Does anybody have any questions for Karla while she's on the phone? I have some that we've had from other webinars we've done.
Brian, I don't see anything in the chat. So why don't you go ahead with some of the other questions and maybe spur on some thoughts.
Okay, yeah, just one question, Karla, that has come up before regarding the PPE. with people coming back to work and where, you know, some employers may require employees either to bring their own mask or provide masks for them, what would you say is, you know, either, you know, best practice moving forward regarding whether it's going to be mandatory or if it's voluntary in regards to who's going to pay for those type of, you know, the type of PPE equipment that they may require for an employer to come back, employee to come back to work?
Sure. So it's important to note that OSHA has not made masks mandatory, so they haven't said that the employer has to provide a mask or the employees have to wear a mask. However, if you decide that that's mandatory in your workplace, you should consider providing that PPE to your employees. Something I heard that's interesting is in California is employees saying, hey, well, if I'm going to have a mask, I'm going to need reimbursement for water or for detergent to wash that mask. So something to consider as you think about what you're going to require in the workplace.
Okay, and a side question to that, which came up, let's say if you're making mandatory masks and you're providing them, but then you have some employees that come in that, you know, are critically essential employees and they, you know, come back and say, well, I'm very claustrophobic. I refuse to wear this mask in the workplace. You know, so, I mean, how would an employer handle that?
So if someone's refusing to wear a mask and they're saying it's for some medical condition, you have to engage in that interactive process. So ask questions. Is there other accommodations that you can make? Is there something else that you can ensure their safety and the safety of others? So don't just say, hey, you have to wear it or else. There has to be a conversation had.
Okay. Okay, that's good. And then one thing I notated here myself on the I-9 criteria where you can indicate an individual that you can't really verify their, you know, their information, you know, physically until, you know, a later point in time where you indicate COVID-19. Are there requirements in place if an employee comes back to work and then they have to elect either the EFMLA or emergency paid sick because now they've been exposed to potentially, you know, COVID within their household? Is there certain types of, you know, documentation required in that in regards to, you know, documenting correctly for the government?
Okay, so the documentation for emergency sick or emergency family medical leave would be separate from the I-9. So employers do have options to document that. They can't really always require the doctor's note. And of course, in some of those cases, a qualifier for those types of leave could just be childcare. But we do recommend that you document that. So if you need help with that, we do recommend that you talk to your labor law attorney to get some documentation what works. But maybe similar to how you would document traditional leave of absence policies, requests is how you do that. You just want to say, hey, the qualifying reason, there's 6 reasons under emergency sick. Which reason was it? When does the leave start? And then how long? What's the anticipated return to work date?
Okay.
So for emergency sick, that's up to 2 weeks. And the EFMLA, if they qualify, that's up to 12 weeks.
Okay. Okay. And are there certain things in place regarding the covered employers, you know, with the EFMLA and emergency sick, certain criteria that certain, you know, employers have to adhere to? I know it's 500 or less.
Right. Yep. So 500 or less employees. Some exemptions would be healthcare workers. So if you are in the healthcare industry, you could say you're exempt from that. If you have less than 25 employees, you could say there's some other exemptions that you might qualify for. But outside of that, I would refer them to their employment law attorney for the details if you want to claim an exemption from that. Otherwise, you do have to put that posting either virtually or in your workplace and share with employees what your policies are and how they should request leave.
Okay. Okay. Well, thank you, Karla.
You're welcome.
I think we do have one question in the chat. What about the consideration that employers might have a liability if someone contracts COVID-19 after coming back to work? Would it be safer for an employer to buy masks for their employees?
Yeah, so I know that's a lot of talk right now with workers' comp. You know, could an employee say, this is a work-related injury? Is it a reportable injury under your workers' comp policy if I got COVID at work? So there's a lot of discussion about that, and the truth is right now we don't know. They could have got it when they went to get gas, whatever the case may be, but in all cases, I think providing PPE is the right approach, because then you're in better position to say, you know, we're aware there's risk of coming back to work, and here's what we're doing. We've provided hand sanitizer, we have postings about respiratory etiquette, we have done the social distancing, we've allowed for telework, and we're providing masks or other PPE. So I think that's always the best interest of the employer to do that for their employees.
I also have had conversation with some of our members that are having employees say, yes, I'm coming back to work on this date, and then they call, I'm scared, I'm not coming back. There's a heightened anxiety, but could it be, how do you handle an employee that is really not giving you an answer and not saying, I'm not coming back to work? What recourse does an employer have?
You know, fear alone isn't a legitimate reason. So if it's just fear and there's no basis around it, it's not because you're not providing PPE, you're doing that. You're doing the sanitizing, you're doing everything you need to do. If the only reason you're giving is fear or no reason at all, you can let that employee know, outside of any other obligation that you might have, that, hey, there are chances we might have to replace you, right? So we need an answer by this date because we're ready to open. We haven't heard really any good reason for me why you're not coming back to work, so that might be something you have to do.
And,
but again,
and if that,
not
is there a difference if the employee is furloughed or laid off than if you've continued to pay their salary?
Well, you don't have to if they're furloughed or laid off, so you don't have to continue to pay them.
Right.
So traditionally they're not being paid during that time, but if they have a qualifying reason, they might be able to continue to, like we talked about earlier, to decline that reinstatement offer and collect unemployment if they have a legitimate reason. But again,
right.
Yeah.
So if they're collecting unemployment because they were furloughed or they were laid off, and now they're saying, I'm afraid to come back to work, do they have that same recourse of, well, this is when we're opening and your job may not be waiting for you without legal action?
Yeah, that's right. Yep. So, and then the TWC has listed some really good guidance. So absent those reasons, they're going to take it on a case-by-case basis, but fear alone may not be enough for them to decline an offer.
Okay. Well, that's good information. Do we have any more questions? Well, thank you so much, Karla. That was great information. Thank you, Brian, for bringing the program to us and for monitoring the questions for us as well. If your questions didn't get answered during the presentation or during this time, please be sure and email Sherry Sweeney, our Vice President, with your question, and we'll get that to Karla. It is Sherry, S-H-A-R-I, at clearlakearea.com. So thanks so much. I also have a question for those of you that are on the line. We are gathering some information with other chambers of commerce and the city of Houston on as you're starting to open up your businesses, do you have those supplies? Can you get masks, readily get masks? Can you get Clorox wipes? You know, things to make your workspace sanitary. And so if you will let me know by emailing me, if you're having a hard time finding those, we're passing those on to the Greater Houston Partnership and the City of Houston to see what they can do to help you reopen business by having the supplies you need. So again, Cindy, C-I-N-D-Y, at clearlakearea.com if you are having a hard time finding those supplies. So thanks again for joining us today. We encourage you to attend our future webinars. Our next one is next Tuesday, May 19th, and we're happy to have our Houston Mayor Pro Tem, Dave Martin, who is also our council member for the Clear Lake area, to answer some questions about Houston getting back to business. So additionally, we're hosting our regularly scheduled general membership luncheon virtually, of course, in May. And so make plans to join us on Wednesday, May the 27th, where we'll hear from State Comptroller Glenn Hager. I think that'll be very informative. And our luncheon sponsor is Shell Federal Credit Union. So we thank the folks at Shell Federal Credit Union for that. We have several sponsorships available for our webinars and our luncheons. If you're interested, please contact me, Sherry, or one of the members of the staff. Thanks again for joining us today. Thank you again, Karla. We appreciate your insight. It was very informative.
Thank you. Bye.
Have a great day, everybody.